That little pain in your knee when you get up from a chair, or that discomfort in your hip that shows up just from climbing a few steps? A lot of people think that's just age catching up, something normal after 50. But let me tell you something important. Many of these aches are warning signs your body is screaming, and you might not be listening. How many times have you brushed these symptoms off, telling yourself, "Oh, it's just a little strain," or "It'll go away soon"? But will it really? Today I want to speak to you directly, as if we were sitting face to face, heart to heart, because this is serious. What most people don't realize is that behind these joint pains, behind that stiffness in your shoulders, hips, and knees, there could be silent enemies at work, hidden culprits slowly eating away at your joints and bones day after day, without making much noise. Have you ever stopped to think how many bad habits you repeat every day without even realizing the damage they're causing? And here's the scariest part. This damage happens slowly, progressively, and often irreversibly. Do you know what that means? That by the time the symptoms get really bad, the problem has already advanced quite a bit. Many people only find out they have arthritis, osteopenia, or even osteoporosis when they've already lost a large part of their mobility and quality of life. Do you really want to wait until it gets to that point? I doubt it, right? That's why I need you to stick with me until the end of this video, because I'm going to show you the 5 biggest hidden enemies of your joint and bone health after 50. We're talking about things that might be part of your daily routine right now. Foods you eat without thinking, nutritional deficiencies you've never even tested for, and postural habits that seem harmless, but that, over the years, can destroy your joints little by little. Are you starting to realize how much this concerns you? If you've been feeling more tired, more stiff, or getting sore after simple movements, this is your body begging for attention. Let's start with the first silent enemy: excess sugar. Yes, that sweet tooth we often think is just a treat at the end of the day. Did you know that sugar triggers an inflammatory response inside your body? This inflammation doesn't just affect your blood sugar levels or your waistline, it also attacks your joints. Studies show that people who consume high amounts of sugar have a greater risk of joint degeneration and conditions like osteoarthritis. Think about how many sugary drinks, candies, or sweet desserts you eat in a week. Have you been overdoing it? The second enemy is one that most people overlook: chronic vitamin D deficiency. You've probably heard that vitamin D is important for bones, right? But what you might not know is that without enough vitamin D, your body can't absorb calcium properly. And that sets off a chain reaction: weaker bones, more fragile cartilage, and higher risk of fractures. What's worse, studies show that after the age of 50, up to 60% of adults have vitamin D levels below the ideal range. When was the last time you checked yours? And let's not forget about posture. Yes, the way you sit, the way you stand, the way you sleep. Poor posture over the years puts uneven pressure on your joints. That means that parts of your knees, hips, and spine get overloaded, wearing down cartilage faster than it should. Have you ever noticed how you're sitting right now? Shoulders hunched, neck bent forward? Small daily habits like these accumulate over time, leading to chronic joint pain and stiffness. Another hidden villain is excessive stress. That's right. Emotional stress doesn't just mess with your mind, it also affects your body. Stress triggers the release of cortisol, a hormone that, in high levels over long periods, accelerates inflammation and weakens bone density. Ever felt your shoulders tighten up when you're anxious? Or noticed joint pain getting worse during more stressful weeks? That's no coincidence. And finally, one of the most underestimated enemies: a sedentary lifestyle. Staying still for long periods is like sending your joints a message that they're not needed. And when joints don't move, they stiffen. The cartilage loses lubrication. The muscles around the joints weaken. And little by little, your range of motion shrinks. Be honest. How many hours a day do you spend sitting? Are you giving your joints the movement they need to stay healthy? And maybe now you're asking yourself, but how do all these enemies work together inside my body? That's a great question. The truth is, these factors don't just act separately. They create a perfect storm. For example, someone who has low vitamin D, consumes too much sugar, spends hours sitting, and is under chronic stress, is living in an environment where the body is constantly inflamed, poorly nourished, and structurally overloaded. The result? Pain, stiffness, loss of mobility, and a growing risk of serious joint diseases. Can you see how it all connects? Let me explain in simpler terms. Imagine your joints as hinges on a door. If you don't lubricate them, they get rusty. If you slam the door over and over again, the hinges loosen and break. If the material of the hinge is weak, it doesn't withstand the daily strain. That's exactly what happens inside your body when you ignore these 5 enemies. Your cartilage wears down. The synovial fluid, which acts like a natural lubricant, decreases, and the bones start to rub against each other. This is what generates the classic pain and the famous creaking sounds in the joints. And here's something important. This isn't just about pain today. It's about your independence in the future. I've seen too many patients who, in their 60s and 70s, had to give up simple activities, like walking in the park, climbing stairs, or even playing with their grandchildren. And you know what they often say? "Doctor, if I had known, I would have taken better care of myself back then." I don't want you to have to say that years from now. That's why this conversation here is so urgent. Let's dig a little deeper into the damage that sugar does. When you eat excess sugar, your body produces more insulin. High insulin levels trigger systemic inflammation. And this chronic inflammation doesn't just affect your arteries or your belly fat. It directly damages joint tissues. The synovial membrane gets irritated, the cartilage breaks down faster, and even your bone density starts to suffer. Have you noticed that your joints feel more swollen and painful after eating sweets or processed foods? That's not your imagination. And about vitamin D, it's not just a bone vitamin, as many people think. It's actually a hormone that controls over 200 functions in your body. One of them is calcium absorption. But it also regulates the immune system and the body's inflammation response. Without enough vitamin D, your body becomes more vulnerable to autoimmune attacks, where your own immune system can start attacking your joints, like in rheumatoid arthritis. Do you get enough sunlight daily? Do you take supplements when needed? These are questions you can't ignore anymore. Now let's talk about posture again, but in more detail. Every time you sit slouched on the couch or spend hours on your phone with your neck bent forward, you're creating micro-traumas in your joints. Over months and years, these small traumas turn into chronic injuries. The cartilage thins, the muscles around the joint weaken, and even your spinal discs start to compress. That's why many people feel that classic neck or lower back stiffness when they wake up. Does this happen to you too? And stress. Oh, stress. We live in a world where being stressed has almost become normal. But let me explain clearly. Cortisol, the main stress hormone, when it stays elevated for long periods, literally steals calcium from your bones. That's right. Your body, trying to adapt to stress, sacrifices bone mass. The result? Increased risk of osteoporosis and more fragile joints. Do you often feel tense, anxious, or emotionally exhausted? Your joints are feeling it too, whether you realize it or not. A sedentary lifestyle also creates a vicious cycle. The less you move, the more your joints lose lubrication and flexibility. And the stiffer you feel, the less you want to move. Day after day, the muscles that should stabilize your joints weaken, your balance worsens, your risk of falls increases, and the cartilage, that precious cushion that protects your bones, starts to thin. How many times a day do you get up just to stretch? Have you been giving your body the movement it desperately needs? And here's another key point. All these enemies tend to get worse with age. But age alone is not the villain. I've seen people over 70 with incredible joint health, and young people in their 30s already suffering with joint pain. The difference? Lifestyle choices, habits, awareness. That's why what you decide to do today can completely change how you'll move and live 10, 20, or even 30 years from now. Are you ready to take control? Before we move on to solutions, let me ask you something. Of everything I've said so far, Which of these silent enemies do you think affects you the most right now? Is it sugar, vitamin D, deficiency, bad posture, stress, or a sedentary lifestyle? Take a moment and think honestly. Awareness is the first step toward change. And in the next part, I'm going to show you what to do to protect your joints starting today. Let's start talking about practical solutions. First, let's tackle sugar. Reducing your sugar intake is one of the fastest ways to lower inflammation in your body. That doesn't mean you'll never eat a piece of cake again, but it does mean making better daily choices. Swap sodas for water with lemon. Replace industrial sweets with natural fruits. Start reading labels. You'll be shocked at how much hidden sugar is in things like bread, sauces, and even so-called healthy snacks. Could you commit to reducing sugar starting this week? Now, about vitamin D. The most natural source is sunlight. Just 15 to 30 minutes of sun exposure on your skin, 3 to 4 times a week, can already make a difference. But depending on where you live or your skin tone, supplementation might be necessary. The ideal is to do a simple blood test to check your vitamin D levels. Talk to your doctor about it. Don't leave it for later. This small action can prevent serious joint and bone damage in the future. When was the last time you got some sun? On the topic of posture, this is about awareness. Start by observing how you're sitting right now. Straighten your spine, pull your shoulders back slightly. Raise your chin. Simple, right? Now multiply this attention by all the hours of your day. Whenever you're on your phone, working on the computer, or watching TV, check your posture and include stretching exercises and mobility routines in your mornings or evenings. Your joints will thank you. Can you commit to checking your posture at least 3 times a day? As for stress, I know it's not always easy to control external situations, but you can control how your body responds to them. Breathing exercises, meditation, short daily walks, moments of disconnection from screens. All of this helps regulate cortisol levels and reduces the inflammatory impact of stress on your joints. Have you taken at least 10 minutes for yourself today to breathe and relax? Your joints need this as much as your mind does. And let's not forget about movement. Staying active is non-negotiable. That doesn't mean you need to become a gym fanatic, but it does mean making conscious decisions to move your body every day. Simple things. Take the stairs instead of the elevator. Get up every hour and stretch. Go for short walks after meals. If you enjoy dancing, swimming, yoga, or Pilates, even better. What matters is to stay moving. Which physical activity would fit best into your routine right now? Another crucial point is hydration. Your joints need water to stay lubricated. The synovial fluid inside each joint is composed mostly of water. Dehydration makes your joints stiff and more prone to wear and tear. Aim for at least 2 liters of water per day, and even more if it's hot or if you're exercising. Do you know how much water you've had today? This is an easy habit that makes a huge difference. Nutrition as a whole plays a huge role too. Besides cutting sugar, increase your intake of anti-inflammatory foods, omega-3s from fish or flax seeds, colorful fruits and vegetables, olive oil, nuts. All of these help reduce inflammation and protect your joints. Adding collagen supplements with medical guidance can also help rebuild joint structures. How colorful is your plate during meals? Have you been nourishing your joints with the right foods? And sleep. Oh, how underrated sleep is. During deep sleep, your body releases growth hormones that help repair tissues, including joint and bone tissues. Poor sleep quality increases inflammation and makes your joints more sensitive to pain. Aim for 7 to 8 hours of good quality sleep per night. Create a sleep routine. Dim the lights, avoid screens before bed, and keep your room cool and quiet. How's your sleep hygiene? Are you giving your body the rest it needs? Another tip that can make all the difference: include strength training in your life. That's right. Lightweight training helps strengthen the muscles that support your joints. Strong muscles reduce pressure on the joints, improve stability, and prevent injuries. Of course, it's essential to have proper guidance to avoid overload. Even at home, with bodyweight exercises, you can start improving. Have you ever thought about adding some muscle strengthening movements to your week? And finally, consistency. None of these habits work if done sporadically. The secret to joint and bone health after 50 is consistency. Small daily actions that accumulate benefits over time. Remember, your body is a reflection of what you repeat, not what you do occasionally. Which of these changes are you ready to start today? Pick at least one, and make today your starting point. Before we move forward, let me share something I see. All the time in my medical practice, people start making changes, but after 1 or 2 weeks, they give up. They go back to old habits, and then, months later, they show up at the clinic saying, "Doctor, it's worse now." That's why I'm insisting so much. This is not a temporary fight. It's a lifelong commitment to your body. Do you agree that your future mobility and independence are worth this effort? And I want you to understand, it's never too late to start, even if you're already over 60, 70, or even 80. The body has an incredible ability to respond when you take care of it. I've seen elderly patients regain strength, reduce pain, and even walk without help after making lifestyle changes. The human body is resilient, but it needs your help. What's stopping you from taking the first step today? Let's do a quick recap of the 5 silent enemies we've talked about. First, excess sugar and its inflammatory effects on your joints. Second, vitamin D deficiency, which weakens your bones and reduces your body's defense against inflammation. Third, poor posture, creating microtraumas that accumulate over the years. Fourth, chronic stress, with cortisol destroying your bone and joint health from the inside. And fifth, a sedentary lifestyle, stealing your mobility day after day. Which of these surprised you the most? Now imagine, if these enemies are acting together inside your body right now, what will happen in 5 or 10 years if you don't make changes? The answer is simple: more pain, more stiffness, less mobility, and more dependence on others. But here's the good news. With information and action, you can reverse much of this process. How does it feel to know that the decision is in your hands? Let's talk about mindset for a minute. Many people have that inner voice saying, "Oh, I'll start next month, after the holidays, after I retire." But your joints don't wait. Every day counts. The small changes you make today will build the body you'll live with in the future. Are you going to keep postponing your health, or will today be the day you choose to take control? One more important point. Don't fall for the trap of thinking that just taking a pill will solve everything. There's no magic capsule that can reverse years of damage. Medications help, yes, but they're just one part of the puzzle. True joint health comes from movement, nutrition, good sleep, emotional balance, and care with posture. Are you willing to embrace this holistic approach? And if you're feeling overwhelmed right now, thinking, "Wow, it's a lot to change," breathe. Start with one habit. Just one. Drink more water. Go for a short walk. Eat one less sugary snack. Sit straighter. Take a 5-minute sun bath. What matters is to start. Small steps, done consistently, bring big results over time. Which small action can you commit to today? And speaking of results, let me tell you about Maria, one of my patients. At 62, she came to me with severe knee pain, already limping. After changing her diet, starting vitamin D supplementation, working on her posture, and doing low-impact exercises, 6 months later she was walking in the park again, pain-free. Stories like hers happen when there's commitment. Could your story be the next one? Now, I want you to picture yourself in the future. Close your eyes for a second and imagine, how do you want to move when you're 70? Do you want to be able to play with your grandchildren, travel, dance, or will you be sitting, watching life go by, regretting not having taken care of yourself? This is the moment to decide which path you'll take. And one final reminder, no one will care for your joints more than you. Not your doctor, not your family, not your friends. This is your responsibility, your body, your future, your choice. And the best part, starting is 100% in your control. So, what's the first step you're going to take today? And if you're still with me here, listening, thinking, reflecting, that already shows you care about your health. And that's a huge first step. Awareness always comes before change. Many people live their whole lives ignoring the signals from their body until it's too late. But you're here, taking in this information, and that alone puts you ahead. Are you ready to turn awareness into action? Another thing I want you to remember, this isn't about being perfect. It's about progress. If you can reduce sugar by 50%, that's progress. If you get 10 more minutes of sun this week, that's progress. If you get up and stretch every hour, that's progress. Celebrate each small victory, because each step you take today is one less step toward pain and immobility tomorrow. Can you commit to celebrating these wins along the way? Also, don't go through this journey alone. Share what you've learned today with your family, your friends, your partner. Start conversations about joint and bone health. Encourage others to adopt healthier habits too. When people around you join in, it gets easier to stay motivated. Who do you know right now who could benefit from hearing this message? And of course, always involve your doctor in this process. Schedule that checkup you've been postponing. Ask for your vitamin D test. Get professional guidance for your exercises and nutrition. Nothing replaces personalized medical advice. What I'm sharing here is educational, to empower you with knowledge, but your doctor will help tailor the best plan for your individual needs. When was your last health checkup? I'll leave you with one last image. You picture two futures. In one, you wake up every day with pain, stiffness, limited mobility, feeling like your body is betraying you. In the other, you wake up with energy, strength, and the freedom to move, enjoying simple pleasures like walking, playing, traveling. Which future do you want to build? Starting today, your joints are with you for life. Treat them with the care they deserve. They're not replaceable, and the actions you take now or fail to take will determine your mobility, your independence, and your quality of life in the years to come. You don't have to live with pain. You don't have to accept discomfort as part of aging. There's so much you can do, starting right now, so here's my invitation. Pick one habit, just one, and start today. Drink more water, get more sun, stretch, reduce sugar, move, breathe. Choose one small change and commit to it for the next 7 days. Next week, add another. And little by little, you'll rebuild your joint health from the inside out. If this video helped you, share it. Send it to someone who needs this wake-up call. Leave a comment telling me which enemy you're going to face first. And if you want, tell me your age and your biggest joint health goal. I'll be here, cheering for your progress. And remember, your body listens to everything you do for it, and everything you fail to do. Take care of it, and it will take care of you.